Welcome to the Dr. Mudgil podcast. This is episode 184. We are just about wrapping up May here at the very, very tail end of it. I can't believe how fast this year has gone by. My kids just have a couple of weeks of school left. It has been one cold, rainy May. It's actually not so cold today, but it's rainy. It continues to be very rainy. Rainiest May, I think, ever in history, but hopefully that means it's going to be a very sunny, beautiful summer. My Knicks, so it is Thursday night, and the Knicks are in deep trouble. We're down 3-1. Back in New York tonight. Hopefully we can pull one out. I still say Knicks in 7. I hope that's still the case by the time this podcast comes out. Hope we're still in the Eastern Conference Finals and have not been eliminated. But as an ever optimistic Knicks fan, I think we're going to take them. I think we're going to take them tonight, and I think we're going to take these guys out in 7 games. Fingers crossed, and hope the basketball gods are listening to what Knicks fans are praying for. So anyways, back to the subject matter of this podcast, and you're not going to believe it. Well, you probably are going to believe it, but UnitedHealthCare has done it again. I mean, literally, I think the most evil institution on the planet. And I said it before, when you're healthy and you're doing great and you're paying your premium and you're not using your health insurance, all insurance companies, UnitedHealthCare being the ugliest of the bunch, the worst, most evil, vile institution of all of the health insurance companies, but all of them operate using the same nefarious playbook. And when you're healthy, you're paying your premium, you're not using your health insurance, they love you. You're just paying into the pot, they're sitting on it, they're investing it in various things, they're generating wealth for their CEOs who make $20 million a year, all off of the backs of patients and their doctors, by denying patients benefits, denying doctors payments they deserve after already rendering care. It's a crazy broken system. And what I've said is, the second you get sick and the second you need to use your health insurance plan, companies like UnitedHealthCare quite literally wish death upon you. They want you to die as fast as possible because, you're cutting into their bottom line. You're cutting into their profit margin. You're cutting into the bonuses that they could give their executives and administrators and, all of the folks that work for these evil companies. And I have evidence of that. And I thank Ismail, my videographer, for finding this article. I'm just going to share a bit of it with you just because, I figure there's no better way than going to the source. This was an article that came out in The Guardian, and the title of the article is, "A Guardian Investigation Finds Insurer Quietly Paid Facilities That Helped It Gain Medicare Enrollees and Reduce Hospitalizations. Whistleblowers Allege Harm to Residents." U.S. nursing home employees, skip that part. Okay, here we go. United Health Group, the nation's largest healthcare conglomerate, has secretly paid nursing homes thousands in bonuses to help slash hospital transfers for ailing residents. Part of a series of cost-cutting tactics that has saved the company millions, but at times risk residents' health, a Guardian investigation has found. Those secret bonuses have been paid out as part of UnitedHealthCare program that stations the company's own medical teams in nursing homes and pushes them to cut care expenses for residents covered by the insurance giant. In several cases identified by The Guardian, nursing home residents who needed immediate hospital care under the program failed to receive it after interventions from UnitedHealthCare staffers. At least one lived with permanent brain damage following his delayed transfer, according to a confidential nursing home incident log, recordings, and photo evidence. "No one is truly investigating when a patient suffers harm. Absolutely no one," said one current UnitedHealth nurse practitioner who recently filed a congressional complaint about the nursing home program. "These incidents are hidden, downplayed, and minimized. The sense is, well, they're medically frail, and no one lives forever." Again, UnitedHealthCare is wishing them death. The Guardian's investigation is based on thousands of confidential corporate and patient records obtained through sources, public records requests, and court files, interviews with more than 20 current and former UnitedHealth and nursing home employees, and 2 whistleblower declarations submitted to Congress this month through the nonprofit legal group Whistleblower Aid. The document and sources provide a never-before-seen window into the company's successful effort to insert itself into the day-to-day operations of nearly 2,000 nursing homes in small towns and urban commercial strips across the nation, an approach which has helped UnitedHealth secure a vast stream of federal dollars, your taxpayer dollars, my taxpayer dollars, from Medicare Advantage plans that cover more than 55,000 long-term nursing home residents. United Health said that suggestion that its employees have prevented hospital transfers is verifiably false, of course. It said its bonus payments to nursing homes help prevent unnecessary hospitalizations that are costly and dangerous to patients, and that its partnerships with nursing homes improve health outcomes. Costly is the most important word in that sentence, by the way. Under Medicare Advantage, I have several podcasts about that, which we'll put the links to in the description. Insurers collect lump sums from the federal government to cover seniors' care. But the less insurers spend on care, the more they have for potential profit. No shit. An opportunity that United Health's higher-ups have systematically sought to exploit when it comes to long-term nursing home residents. United Health long-term nursing home plans enroll nearly as many as all other Medicare Advantage plans combined. To reduce residents' hospital visits, United Health has offered nursing homes an array of financial sweeteners that sounded more like they came from stockbrokers than medical professionals. Over the past 7 years, the company has shelled out premium dividend and shared savings payments that boosted nursing homes' bottom line. Through its quality and shared risk program, United Health offered an even bigger cut to nursing homes that drove down medical spending, but threatened to claw back money from those that didn't, according to former employees and internal corporate documents. One term that United Health executives obsessed over was admits per thousand, APK, for short. It was a measure of the rate that nursing homes sent their residents to the hospital. Under the premium dividend program, a low APK qualified a nursing home for various bonus payments the insurer offered. A high APK meant that nursing homes received nothing. APK drove everything, said one former national United Health executive who worked on the initiative with nursing homes in more than 24 states and spoke about the confidential contracts on the condition of anonymity. You gain profitability by denying care. And when profitability suffers for the shareholders, that's when people get crazy and do things that are not appropriate. The revelations came at a time of crisis for United Health, which became the subject of public outrage after December's fatal shooting of Brian Thompson, a top executive at the company, and the arrest of a suspect named Luigi Mangione. The article goes on and on, but I think you pretty much get the gist of it. So the bottom line is Medicare Advantage is complete bullshit. It's basically a capitation system where private health insurers like UnitedHealthCare get paid a lump sum of money for the number of patients they enroll into their plan. So say they, X amount of dollars. Well, if they enroll like 1 million patients into their plan, they get a million X amount of dollars, whatever that X is. And the way insurance companies make money is they deny benefits for the patients. So if someone needs to go to the hospital from a nursing home, hey, that's very expensive. It costs them money. They do everything they can to stop that from happening. So much so that they inserted their own employees into nursing homes to verify, hey, this patient has UnitedHealthCare, it's a Medicare Advantage plan, and if they go to the hospital, we're going to lose a lot of money. So we're going to do everything we can to keep that patient in the nursing home. They're also part of a federal investigation where they would upcode certain things. So like various services that they offer their patients in a nursing home get bonuses from the federal government. Yes, your taxpayer dollars and my taxpayer dollars. So they're literally milking the system, which is illegal, and they're under a federal investigation for that. Their CEO just stepped down. And I hope there are severe consequences for these folks because it is incredibly immoral, illegal, just evil, in fact, what they did. And in this case, what they're doing is, a patient, they later in the article, and we'll put a link to this article so you can read it, and, it will literally blow your mind. But there was a patient who had a stroke and needed to go to the hospital for intervention, but the United Health employee said, no, just give them aspirin and keep them here. And this poor guy suffered, which is exactly what you're not supposed to do when someone's having a hemorrhagic stroke. And the patient declined and ended up, I think ended up dying or getting, severely disabled and ultimately dying or something like that. I can't remember the details. But had they gone to the hospital, the outcome may have been very different. If UnitedHealthCare had allowed them to go to the hospital, which is the standard of care, the outcome for this poor patient might have been very different. As you've heard me say many times over, the most important part of any anti-aging skin regimen is using a proper sunscreen, namely one that's at least an SPF 30 and contains titanium or zinc or both. I couldn't be more excited to announce the launch of these two amazing Dr. Mudgil brand sunscreens. One is tinted, one is non-tinted, depending on what your preference is. I also have an amazing hydrating and moisturizing serum, which your skin is absolutely going to love. There's a link in the description below, which you can click to check out the products. You are going to love them as much as I do. Listen, UnitedHealthCare and any insurance company, for that matter, is not your friend. All they care about is effing you over as the patient as much as they possibly can by denying you the benefits that you need. And on the other side of things, they're effing the doctor over because, what we do is we see a patient and we assume all that risk for seeing the patient. We don't know if we're going to get paid or not. And frequently we submit our claim to UnitedHealthCare and then they play their games and, they try to delay us payment for services already rendered, or sometimes they'll just flat out deny it. Even though we've already taken care of their patient and cured them, they'll say, you know what? We're not going to pay you for that. It's complete, utter bullshit. This system is broken. And if you wonder why things aren't changing, I'll tell you exactly why. Because our elected officials, our senators, our representatives, they're all getting paid off by these evil bastards. And it's not direct. It's done in back rooms, in clandestine ways where political action committees are funding their campaign. And I bet you every single one of our elected officials, or nearly all of them, if not all of them, are getting some kind of money from UnitedHealthCare, sprawling hospital systems, other private insurance companies, all forces that are working against you as the patient and me as the doctor. And it is absolute insanity. I hope they just destroy UnitedHealthCare. I hope the government really takes this seriously. And they will if we speak up, if patients and their doctors are vocal and acknowledge that, hey, we know what's going on here. We're not stupid. We see it happening right before our eyes. We see how Medicare Advantage provides absolutely no advantage for the patients. It's purely an advantage for private health insurers to, bolster their profit margins. Again, all off of the backs of patients and the doctors that care for them. Again, it's a very simple math. There's a pot of money. In the case of Medicare Advantage, that pot of money is generated by our taxpayer dollars. You and I are paying into that, into the federal government. The federal government gives UnitedHealthCare and other private health insurance plans money that we paid into the system to administer Medicare Advantage. But you know what UnitedHealthCare and these other insurance companies do is they want to sit on that money for as long as they can and sit on as much of it as they can. And there's only two ways they can do that. They can deny you benefits as a patient. You're in a nursing home and you need to go to the hospital. That's very expensive. So they'll do everything they can to deny that you receive the care that you need, which is crazy. I mean, hospital administrators, our nursing home employees that work for UnitedHealthCare, they should have zero say in patient care. They're not doctors. They didn't go to medical school. They should have zero say. But every decision they make is based on preserving and or maximizing their profits. And on the flip side of it, they'll do everything they can to deny your doctor gets paid for services already rendered. It's a crazy racket. It's a broken system. We all must be vocal about it. So check out the article. Write to your senators and your representatives, even though they're on the take from these bastards, most likely. But they should know that we, the folks that elected them into office, know what they're doing. And it's time to expose that, because once it's exposed, and the more vocal we all are, it may create the swell needed for long overdue change to happen. So with that, I hope you all have a wonderful, restful weekend. Let's go, Knicks. Let's get it.